We never really know what causes breast cancer in an individual patient, but there are many risk factors for breast cancer, and that's what we talk about. We talk about them in terms of risk factors. So the most important risk factor is that you're a woman. Much higher risk of getting breast cancer, less than 1% of all breast cancers happen in men. The second risk factor is your age. And contrary to what a lot of people think, the older you are, the higher your risk of breast cancer. So it's important for women to continue to pay attention to their breasts after they've had their children, keep going to the gynecologist, keep seeing the family practitioner, get your mammograms, and the older you are, the more important they are for you. Then there are other risk factors. If you've never had a child, you're at an increased risk for breast cancer. But if you have your first child after the age of 35, your risk is even higher than somebody who never had a child. Hormone replacement therapy increases your risk for breast cancer. Birth control increases your risk for breast cancer. 85% of women with breast cancer have no family history of breast cancer. So many patients who come to see me say, "It's not in my family, how can I have it?" And I tell them, you're in the majority. You're the typical breast cancer patient without a family history. Only about 15% of women with breast cancer have a family history, of which about a third are genetic mutations that we know about. So even those with a family history, we don't always know exactly what caused the breast cancer. We do know that there are dietary influences that can increase our risk of breast cancer. So obesity, having a high BMI or body mass index, and you can ask your physician, what's my BMI and what can I do to reduce it? Drinking alcohol, 2 drinks a day, increases a woman's risk for breast cancer. So the recommendation is to reduce your alcohol to nothing, but if you do drink, no more than 1 drink for a woman a day and 2 for a man. So there are multiple risk factors for breast cancer, and some we can change and some we can't. We can't change who our parents are, but we can change our activity, our diet, and how we go for our screenings.